Knee pain exercises. So for a lot of people who have knee pain or osteoarthritis, very simple exercise you can do if the pain is moderate to severe. Sit on the edge of a bed like this, with the feet off the floor. What you're going to do is some gentle swings like this right here. People who have severe knee pain, this is a good starting point. Just swing to the point where you're not feeling a lot of pain. If you go too high and you begin to feel pain, don't go this high at this point. Just short of that point. Gentle leg swings. Do this 5 minutes at a time. Take a break every couple hours, 5 minutes at a time. What it does, it helps to retain mobility in the knee joint. That's with the circulation of the fluids in the knee joint. What you don't want to do is to overly rest your knees where your muscles are getting weaker, joints are getting stiffer, and everything goes downhill at a lot faster rate. You can also, before you do this, you can probably rub some anti-inflammatory gel, some cream on the knees, or take some anti-inflammatory medication to help with the pain a bit, which will allow you to do the exercise more effectively and also for the required length of time. As you get comfortable with 5 minutes, bump it up to 10 minutes. Watch TV, put on your phone, make the time go a lot faster. So as you get comfortable with the leg swings and you're developing more strength and more range of motion, you can do some leg extensions. You do it with both legs or one leg at a time. So let's do one leg at a time. So in this case, you're going to pull the foot up like this, come up, really squeeze the quad muscles, and then you come down slowly. Pull this one up, come up slowly, control the movement, squeeze the quad muscles, down slowly. What you don't want is a swinging movement. What you don't want is this and this, okay? And that's just going to lead to injury of the ligaments of the knee, and now you're going to have a ligament injury on top of the arthritis. That's just going to make the situation worse. So again, if you want to do both legs at a time, up, come up, squeeze the quad muscles, slowly. What this does helps to maintain or increase the range of motion in the knees, as well as strengthen the leg muscles. Strong leg muscles help with the pain of knee arthritis. It can slow the degeneration of the knee as well, by giving the knee that extra mechanical support. Now, as you get better and better, what you can do, you can add some resistance to the leg. So you use the opposite leg to add resistance. So you rest this leg right here, like this, pull up. Just relax this leg and let this leg do all the work. Come up and down. Up. Just relax this leg and down. 10 times or more if possible. Switch over. Just relax leg. Just let it rest on the working leg. Pull the foot up like again like this. And now you're lifting the resting leg with the working leg. Control the movement. Control the movement. And down. So now we're going to exercise the calf muscles. So what you're going to do, you're going to face the wall and you're going to tiptoe. Support yourself like this here. Come up. Hold for a second or two. Come down. Come up. Hold for a second or two. And come down. Control the movement. Don't do that. Come up, squeeze the calf muscles, come down, control. And what you're going to do the opposite. You're going to exercise the anterior tibialis. That muscle pulls the foot in the opposite direction, like this. The calf does this, anterior tibialis does this. So we're going to exercise this muscle. Lean against the wall, a bit forward. What you're going to do now, you're going to raise the toes. It's very simple, looks very innocent. But by the time you hit about 10 reps, you're going to feel burn at the anterior tibialis. Pull up, hold it for a second or two, control. Again, it's not, okay, you're not doing that. You're doing this. Hold, and down, up, and down. So now let's practice sitting and standing, which is a very important part of daily life. What you're going to do chair squats. But you stand close to the wall or a table for balance. Then you come down slowly into the chair. Lean forward, push up slowly. Again, don't let your body drop into the chair like this. If you find yourself losing strength in the legs and you're going to fall, that is why you have the support next to you. If you feel like you're going to fall, give yourself some support and control and get into the sitting position. Now, for some people, this depth might be a bit painful for the knees, so you can work your way into that depth. So you can probably put a pillow on the chair so you don't have to sit as low. So now you're here instead. So now you're coming down. Come up. Work with the depth that is comfortable for you. You may feel some discomfort, but if you're feeling unbearable pain or pain that you think is a bit too much, you want to elevate that seat. Put a couple cushions on the chair so you don't have to go as low initially. And with time, you can adjust the amount of cushions on the chair so as you get deeper and deeper and deeper. What you want to do is to be able to control your descent. Falling on a chair or falling on the toilet bowl too quickly can lead to the fracture of the spine, so you don't want that to happen. Very important movement, sitting and standing. What you can do to make the chair squat a little more challenging, to get better and better and you feel more comfortable as you're descending, probably use less support. And when you reach a certain point, you might just want to hold it there for 3 to 5 seconds and go back down. Come up. When you're going back down, 3 to 5 seconds, then descend. Okay, so that makes it a bit more challenging as you get stronger and you feel more comfortable. You can also maybe hold some weights if you have some light dumbbells at home, maybe 1 pound or 2 pounds, hold it in front of you or hold it like this to do your chair squats. If you don't have dumbbells, a bottle of water, and that would be some additional weight that you can add to the movement as well. So now we're going to do a hamstring movement. The hamstring will be behind the leg. We did an exercise targeted the quadricep muscle. We're going to do the opposite movement now to deal with the hamstring muscle. So for this one, you will be lying on your belly, like so. So let's say I'm going to work the right leg. This is the movement that I want. I want to bend the knee. Some people, this might already be a challenge. Bending the knee might cause pain. So you might want to start with this first. Yes. Up and down. If you're getting pain in your knee because of the knee pressing into the bed, you can put a pillow under the thigh. So doing this might make it a bit more comfortable by taking some of the pressure off the knee. So you can practice the movement. Even though there's no weight on the leg, the hamstring still has to deal with the weight of the lower leg. So there is some resistance on the hamstring muscle. So some people might begin to get pain when they're here. And with time, you might want to work up to increasing the range of motion where you can bring the knee in a bit more. And now if you want to add some weight to the exercise, take the opposite leg, just rest it right here. And so if this is comfortable for you, now you're lifting the resting leg with the working leg. So in this case here, my right leg is working against my left leg. I'm just resting the left leg there. That's just some additional weight for the hamstring muscle. Then you switch it over and repeat the process. Take it easy. Don't try to apply too much pressure to the working leg with the resting leg. This may not be applicable to everybody because the position of the resting leg might be uncomfortable. If you have a friend or family member, they can put some light pressure on the back of the calf muscle here to give you some resistance to really work that hamstring muscle. So we spoke about the chair squat. Now, not everyone will be able to do that again because of the pains in the knees. So what you can do what is called a wall sit. So you can lean against the wall, bend the knees, just to the point where pain now starts, and just sit. Let these muscles work. It's a good starting point if you're unable to do the chair squats. And with time, what you may find yourself you might be able to go a bit lower, 30 seconds to a minute. You're going to feel here really beginning to burn, and yes, it can cause you to be sore the next day. That is quite normal. Now, even if you're able to do the chair squats, you can also tack on this exercise to your regimen just to give you some variety. You to ease the boredom of the same routine over and over and over. It's always good to have a variety of exercises to prevent boredom. So this is the wall sit, a great way to strengthen the knees. Use your hands. Take a break. See if you can maybe go down a little lower next time. If not, Just go where you're comfortable. Relax a little bit, maybe listen to a bit of music. When you're ready again, forward, push yourself up and catch yourself. So again, the wall sit, a nice way to start strengthening of the knees if you have osteoarthritis.
You can tap the description below for all of our contact information.